As the International AIDS Conference draws to a close in Germany, the SA National AIDS Council is calling for increased effort to level the playing field. Now, there's also been a focus on the new way to prevent HIV infection, which has also generated much conversation. The treatment consists of a twice-yearly injection. Let's chat about the conference and a look ahead to 2030 as well. Professor Salim Abdool Karim is the director at CAPRISA and joins us live now. Prof, good evening to you, and thank you so much for your time. So, SANEC, for example, making its remarks, they've called for increased effort and scaling up interventions to make certain that everybody has a good story to tell beyond 2030. Looking at the discussions this week at the conference, is the world on track with this?
Good evening, Runiva, and good evening to all of the viewers. Yes, I mean, if you look at the way in which the trajectory of HIV infections has been going in the last 5 years, we have seen a steady decline in the number of new infections. Unfortunately, that decline is not as large in certain groups as we had hoped. So we still have quite a lot to do in terms of prevention and in terms of rolling out treatment. But we have good signs that we are making good progress, and that's always good to see. At the conference, what we heard about is some new data on cure, with a new patient from Berlin being cured with a different kind of bone marrow from the donor, and very interesting results on a new combination of lenacapavir together with bictegravir, also providing good evidence for viral suppression. But the highlight of the conference has been the results coming from lenacapavir. This is an injection that is given to young women at this point, women at this point, in the trials that have been done. And it shows that once every 6 months when this injection is given, that it protects these women from HIV infection. And that's an incredible result because it was completely protective. In other words, there were no infections that occurred in women who received lenacapavir. So that's 100% protection. That's an amazing result. Yeah. In all my 40 years of HIV research, I've never seen such an impressive result. The issues now relate to, is it as good in men? Is it as good in other groups? And those results are weighted, and then we wait for its licensure and rolling it out.
And of course, a lot of people would then be asking, when does it become available, and will it be replacing the pills that people have been taking?
Once we see the results of the other trials, and those trials are still underway, we would anticipate that those results will probably become available within the next 6 to 9 months or so. And then comes the regulatory process, where it has to go to a regulator for approval. And that process can take, any time from a year onwards. So we're looking at this drug only becoming available at the end of next year, or even in 2026 in all likelihood. I mean, hopefully some of that can be fast-tracked, so it might become available earlier. But once it becomes available, the critical issue is going to be, how do we maximize its benefit? Here's a drug, highly effective. How does it change the pandemic?
And, one thing, of course, a lot of people sometimes would say that, these regulations and the approval processes may take long, but also at the same time, when you think about its availability, especially for developing countries, it also becomes yet another issue. So when it comes to these issues, how important will it be for them to be speedily resolved and ensure that everybody has access to it? So as SANEC says, you have a good story to tell come 2030.
I think we've already had some fairly negative experiences. If you take another injectable prophylaxis, a drug called cabotegravir, made by a company called ViiV, that has been shown to prevent HIV infection given every 2 months. That drug was shown to be effective in 2021. It's still not available. And that's because the company itself has chosen to protect its market and make the product only available in wealthy countries, and has not made it available at an affordable level, or even made it available at all in developing countries. So I think we don't want to have a repeat of that situation. What we want is a situation where as we've experienced with other antiretrovirals, that the market is segmented. Wealthy countries pay a higher price, and lower income countries and poor countries, they will pay a price that's called an access price, and that's manufactured by generic manufacturers. This is not new. We've done this on many occasions for most of the antiretroviral drugs. We hope that this is what the path will be for this particular drug, lenacapavir, in which case it would be made available at a reasonable price in the developing world.
Yep, certainly hoping for a reasonable price, as you say, because that also becomes another area of concern. But Prof, you touched on this when we were starting off our conversation. There's certain groups, so we're not seeing the number of new infections go down as hoped, as many would be looking forward to them going down. But there has been a concern when we were speaking to various groups this week about children, the new infections in children, and how this needs urgent attention. Do you agree with that?
Yeah, I'm not really concerned about the number of new infections in children. I mean, we should be heading towards elimination, and many countries have already declared elimination of mother-to-child transmission. One of the big problems we have is that when you have large numbers of new infections occurring in young women who are reproductively active, that's where the problem comes. So if you prevent women from getting infected, in a way you address a key challenge in preventing mother-to-child transmission. You still have to provide the other prevention measures. But to me, you need to look at the problem more holistically.
Prof, and what about then adolescents? Because this is still another area of concern.
A very big area of concern. And if you take right now, there are 3 groups in the world where the incidence rates are much higher than we would like. And in some instances, even going up. That's a concern. And one of those groups is, and a fairly large group, is the incidence of HIV, the number of new infections of HIV in young women in Africa. That has always been a big issue. Women bear the brunt of the epidemic in Africa. Incidence rates in this group have been going down, but they need to go down a lot more, and we're still seeing high incidence rates. The second is young men who have sex with men, and that particular group, they're not using prophylaxis to the extent we'd like, and so the incidence remains high. And the third is in Russia and Central Asia, where those are political issues, where treatment services for the gay community have been compromised on political grounds. And so what has happened is some of those gains have been reversed. So we've got to tackle those 3 challenges if we're going to achieve our goal of ending AIDS as a public health threat by 2030.
Prof, appreciate your time as always. Thank you so much for chatting to us this evening. That was Professor Salim Abdool Karim, who is the director at CAPRISA.